I'm Dr. Laureen Rubino. I am a general surgeon, and I went to Georgetown University undergraduate and Tufts Medical School in Boston for graduate school. I think surgery combines the medical aspects and the technical aspects in a way that I was very interested in, and I thought that I was quite good at. I like that the technical aspects of doing surgery, but it also allows me to do the medical management of some of the patients for the short term. My specific approach to treating patients and what is important to me is to express to the patient my interest in what they're going through as well as what their disease process is. And the way I do that is to educate the patient. I feel that if they understand where we are coming from, they are better to go along with the plan for care. If we educate them in the testing and where the pluses and minuses to their care bring them, they will understand that things don't always go in a straight line, but we will certainly get them to the end of the process. Well, ECHN has been very supportive for the general surgeons in our program. They have given us the technical support in that we have just acquired a new robot. We have all the latest upgrades for laparoscopic surgeries, and whenever we find that there's something new that comes through for our Mastery of Breast program, we have that available to us, and that has been a great asset in treating the community, the patients who come to us, and for us to learn all the new techniques that come out. So as I mentioned before, ECHN has been very supportive in the technical capabilities that the surgeons here have available to them. The newest one being the robot, and I'm very excited about that because the robot allows us to do laparoscopic surgery with 3D. So Da Vinci robot is a new technique that we can use incorporating laparoscopic surgery to do things that would make us a better surgeon because we can see better. We also can operate better because it is it has the facility or the capability of using instruments like your hand to a wrist. So we call it articulating the instruments or bending the instruments. So we can actually get behind things and dissect, whereas before it wasn't a straight-on instrument that was not mobile. The 3D has allowed us to see things specifically that we could not see and magnify it. So that's made an incredible difference in us being able to identify anatomy. And I think that anatomy being quite clear will make the problems that people have had with injuries to certain arteries or veins or anatomical things that we couldn't see much less than it was before. The things that ECHN is now promoting with the Da Vinci robot is gallbladder surgery, hernia surgery, ventral hernia, which means big incisional hernia surgeries, and also hiatal hernia surgeries, splenectomies, and all of those things can be done with the robot. When we do them, we'll be able to see things quite clearly. We will have less injuries. The patients will be happier and there'll be less pain because we don't move the instruments around so much. The robot moves them inside of the abdomen by articulating them, as I said, like a hand to a wrist. I am, I would say, a seasonal athlete. I like certain types of athletic programs depending on what the season is. So in the summertime I bike, in the wintertime I ski, and in the fall and spring I horseback ride. So I try as much as I can to keep active because I think that that's a very important part of our lives. And when my patients come to me and ask me if they can exercise, I understand where they're coming from, and because I do like to exercise. I also am involved in other aspects of medicine in that I was the president of the Hartford County Medical Association, and I think that that's a very big part of physicians coming together, understanding where they're coming from different parts of the state, and what our issues are in just legislative problems and bills that come up. The other part of my life is that I'm married and I have 2 children who are teenagers, so that in itself is a challenge, and I'm trying to keep up with them.